So some people think that shingles is just a rash. It can just look like a rash, but it can be so much more. And so it can cause several different complications. Most often people find that it's very, very painful because it's attached to the nerves. So shingles has a very common complication called post-herpetic neuralgia that's more likely if you're not vaccinated. If somebody gets post-herpetic neuralgia, they often have long-lasting pain symptoms that are associated with the rash that originally erupted with their shingles in the first place. I do have patients that have had symptoms for several months to years that will have daily pain and sensitivity, even if there's like clothes touching their skin, and they may have to see a neurologist or even look at different options to try and control those symptoms and make those nerves slightly less reactive or cause them less pain. What can sometimes happen is if shingles affects the nerves that are closest to your eye, it can cause significant blindness. So that's one complication of shingles that we try to avoid and something that can be sight-threatening. So more common complications of shingles can be cosmetic issues, and so where the rash was, you can get a scar. If it happens on your face, you can get issues with your eyelid just from the scar tissue that forms. Less common complications are when the shingles virus is very, very active, and so it can spread further, causing more severe illness. It can cause pneumonia, it can cause other like brain inflammation as well, and those can be fatal, but those are again less common. And so your age does have a very significant effect on your risk of shingles. As people age, what can happen is our immune systems are slightly less active and slightly less able to suppress an infection. Shingles is a virus that often takes advantage of that, and so as you get older, you can be at higher risk, which is why we recommend the vaccine. So the shingles vaccine can be helpful to reduce the risk or complications if shingles does happen. It can help our immune system react against the shingles vaccine in the future and allow it to fight off the virus from reactivating or reactivating fully in a severe way.